Welcome students to another episode of Learning with Lafferty. Within this chapter, I'm going to be talking about the urinary system and looking at all the parts and organs and how that our body makes the urine that we need to excrete. So like I always, got to introduce Manee, always lurking in the background, which is a good thing. Now, Manee, you have the same type of parts we do when it comes to the urinary system. You have a bladder and kidneys, but you're much better at that balance of salt and water because unlike us, you live a lot of times within salty water. So that's one thing we're going to look at when we're talking about this system is that connection that I would have talked about in prior videos of salt and water. Okay, so if you have a lot of salt, you're going to have a lot of water there, and then if you lose a lot of salt, you're also going to be losing a lot of water. So kind of when we talked about in the digestive system, the importance of that balance. Now this system is also sometimes called the excretory system for a reason, because guess what its main job is? Excretion. Okay, even though this system is going to have a few more functions that I'll talk about here in a few minutes, it is going to do mostly getting rid of the excess products in our body, such as hyper, that our body no longer needs, but most of it is going to be waste, okay, that we do not want to keep and dirty our fish tank. Very similar to if a manatee was living in very dirty water, or any type of fish that lived in dirty water, they will not be able to sustain life for a long period of time. We also have things such as I would have talked about in the last video of the digestive system. Okay, it's going to help to eliminate the water and some salts and some bile and getting rid of some of these drugs throughout with our digestion, but kidneys play a larger role into that. Also, when you breathe, the third system would be your respiratory system. Helps to get rid of some elimination, especially of carbon dioxide, but again, water. And then lastly would be our skin, and you definitely think about with that one would be getting rid of the salts, okay, but we also think about with the sudoriferous, our sweat glands, that also helps to balance this job of our pH levels and the nitrogen levels of our body. So definitely be thinking about when you're thinking about the kidney system, besides getting rid of eliminating, by doing that is going to be the second function of our kidneys, which is going to be homeostasis of body fluids. So we think about homeostasis, remember that balance, and that's going to be regulated through the use of hormones. Now the hormones we'll be looking at, we'll talk about hormones that are going to help with our red blood production. Okay, and one of those is going to be a hormone called erythropoietin, okay, or EPO. That's going to literally tell our red blood cells to increase, okay, when needed, and that's that direct connection between your kidneys and your bone. And then we're going to have a couple other hormones I would have talked about under the endocrine system of the antidiuretic hormone and also the aldosterone. Okay, so aldosterone coming, of course, from the gland that lives on top of your kidneys, of your adrenals. Now, one more other thing besides a hormone for as regulation is going to also be vitamin D. That's going to help with the, of course, absorption of calcium, but it's also going to help with bone health. Now, two other functions of the kidneys directly are going to be blood pressure regulation and blood glucose control, or AKA regulation. Now with the blood pressure regulation, the kidneys help control the blood pressure by altering how much fluid is inside of our body. And especially when we think about the fluid, of course we think about most of the plasma, 90% of our plasma is going to be made out of water. So obviously then that's going to control how much water we have within our blood. But it is the blood pressure within those vessels. Remember, blood pressure is the pressure pressing against the vessel walls. That is controlled, of course, by the heart, of how quickly and how fast that your heart is pumping. So there's going to be that, homeostasis balance between, okay, yes, we need water in our body, but we don't need too much. And with that, we don't need too many other things flowing around our blood that doesn't need to be there, taking up space. So think about low blood pressure and high blood pressure is going to play a huge role into how quickly or not enough filtration is occurring at the kidneys themselves. Now, when you think about blood glucose, be very, very careful with this one, okay? So I don't want you thinking it is that insulin or glucagon that is controlling that concentration of blood glucose. Know that the kidneys can make a small amount, but it actually can be upwards of 20% of glucose from non-carbohydrate sources as needed if we're not eating and not getting enough glucose. Because remember, we always have to have that monosaccharide. Now, one thing with that, the liver is the one that can do more of that amino acid protein through that glucose genesis, okay, production, making glucose from proteins, okay, amino acids. But one bad thing about when that happens, there's always going to be a byproduct of that breakdown, which is going to be nitrogen. Okay, and if you remember anything about our body from the chemistry, that there are 4 main elements our body has: oxygen, carbon, hydrogen, and nitrogen. Okay, so if we have too much nitrogen, levels go up, then remember, then the oxygen levels are going to come down. Okay, and if you remember, we need a lot of oxygen. Okay, so that's that breaking down of those amino acids that we're definitely going to see. Now, with that, the liver and the kidneys have a direct connection, because the liver helps with excretion, because it's going to, the byproduct, the metabolizing of the nitrogen is called urea. And it's the liver that makes, that synthesizes urea. It transports it through the blood system to the kidneys. Then the kidneys are going to get rid of it. Hence, when we think about urine, that name comes from urea, okay, itself. Of course, we'll look at the nitrogen levels here after a little bit. So the kidneys are very specialized in metabolizing and through their mechanical specialization of different little tubes and that filtration of the blood coming to our kidneys. Now, when you're looking at the kidneys, there are some important things you need to understand. Now, it is the main organ of elimination far as what it's making, okay? But besides the 2 kidneys that you have, far as organs, there are 3 other organs that you're going to see within this video in my demonstrations that are also very important. But those 3 don't make the urine. Okay, so they're not about filtrating the urine, they're not about absorption or reabsorption or secreting things into our back into our blood supply or taking from our blood supply and getting rid of it. Okay, they are about literally eliminating it once they receive it. So view them kind of like plumbing. So the kidneys, you have 2 of them, 2 organs. Okay, their main job is making the urine. Okay, so they make the urine. That's important. So view it like this is the sink that makes the water. You know, we know the sink doesn't make the water, it's bringing you water, but it makes the water, okay? The other 3 are going to be like the plumbing, so the sink itself and all the tubes and pipes that go underneath it, they help just to get rid of what they have received. Okay, so kidneys make the urine. There's 2 of them. And attached to both of your kidneys are straws, okay, one of the next organs, called ureters. Okay, and the ureters, these tubes, are going to be directly connected to the kidneys and actually literally are a portion of the kidney name I'm going to talk about here in a minute with the structure. So you can't just rip out the straw from your kidneys, because you literally would compromise the integrity of the kidneys. Okay, we're going to see a name here in a minute called renal pelvis. Okay, that's the top portion, the most superior portion of these ureters coming from your kidneys. But they don't make the urine. Okay, they just drain down, and they drain into the next organ, your bladder. Okay, again, the bladder is just a reservoir that holds the urine, and with that, then it's going to then have a little tail that comes off of it called the last organ, okay, called the urethra. Okay, and that's what's, of course, going to connect up to that hole that exits your body and your pubic area, and is going to allow the urine, but does not make the urine, but it helps it to drain out of the body. And remember, there's part of it we can control, and there's part of it we can't control. Those sphincters. Okay, I've talked a lot about sphincters in prior videos. So definitely know the 4 organs. Okay, remember, organs are just tissue, a group of them, but when you really bring it back to it's a group of cells that we're talking about when we talk about these organs. Okay, so 4 main organ parts within this system. Now, when you get to the kidneys, I want to separate something here to hopefully help you in testing, okay, but also understanding disorders of renal versus urinary. Okay, so renal versus urinary. So anytime you hear the word renal, okay, it'd be a vessel, it'd be a portion or a part or a disorder. When if I say renal, I'm talking about just the kidney. So renal, kidney. Okay, that is very important. Urinary refers to the bladder. Okay, so when I say urinary, of course, it's called the urinary bladder for a reason. When we think about disorders that affect the urinary, okay, there's the urinary system. Okay, so don't go too far with it. Don't overthink it. But definitely know when we talk about like urinary suppression versus renal suppression, one is kidney, one is bladder having problems or not even functioning like it needs to. Okay, so we think of like arteries. The renal artery is bringing it to the kidney. Okay, urinary blood vessel is bringing it to the urinary bladder. Okay, and of course you would get into, of course, obviously, you know, the individual parts themselves. Now let's look at, I want to talk just briefly here because obviously I'll have a demonstration here in a moment that you'll see and see the different parts, okay? But I want to talk about the names to get you comfortable before you see the demonstration, which I think does a much better job of like walking you through the individual parts instead of me just talking about them. Okay, but let's talk about the names. So we're just going to start on the outside and work our way in and then work down, obviously, to the ureters and the bladder and the urethra. So the kidneys itself are surrounded, they're called retroperitoneum. So retroperitoneum for a reason, because they're outside that peritoneum, remember that we talked about in the last video. And again, if you don't remember some of these portions, always go back. And I highly encourage you to always go back and look at portions of the video that when I'm talking about something in a video and you don't understand, that's bad, okay? You've got to understand these portions of the Lego mess, okay, in order to understand these portions of the Lego mess, okay? So think about if you're building something, if you don't understand how to put the pieces together over here, then that structural integrity is going to cause a problem on this side, okay, with that. So when you think about the kidneys themselves, that peritoneum, they're outside of that, hence it makes it easier when you have surgeries and stuff. The right kidney is a little bit lower than the left kidney because it accommodates for the liver. Okay, kind of would have seen that with the lungs versus where the heart is also located at. Now you think about the coatings on the outside, there is a fibrous connective tissue coating on the outside, and then below that you're going to find some adipose tissue to give it a little extra little cushioning. But then when you truly get to the kidney itself, you're going to see the cortex, renal cortex, and the renal medulla region or medullary region. Okay, so the cortex, renal cortex, is on the outside, you know, the outermost portion of the kidney, and then right inside, as you get a little bit deeper, closer to the middle, is the medulla region, renal medulla. Now, those two areas of the kidney we're going to look at more intensely here in a minute. That's where you're going to find these specialized units that literally make the urine. You're going to have millions of these little guys called nephrons. So definitely know that within the cortex and the medulla region, renal, is you're going to find nephrons. Okay, and I'll put a pin in it, come back to nephrons here in a minute. So now as you're going more towards the middle, okay, you're going to find an area called the renal pelvis. Now in between that cortex region, it kind of looks a little bit lighter in color and darker. You're going to find like little columns that go between those areas, okay, in between those spaces that you will see. When you look at the medullary region, it looks like a pyramid, so it's got a triangle shape to it, so that's why they call it the renal pyramid. So again, again, don't get too caught up in those extra names, but they are names referring to certain little spots. So if someone was having an infection of the renal pyramids, we're referring to more of the medullary region, okay, which is definitely important to understand as we get into the disorders. Now, when the urine is made within the cortex and medullary region through this tube system inside the nephrons, then it's going to drain into the most superior portion of your ureters, and that is called the renal pelvis. So definitely think about, again, this tube system making the urine. It's got to go into a basin. So think of your sink, okay, is going to be that pelvis. That's literally what pelvis means a basin. So as the urine is made, it drains through a funnel called the calyx. So the renal calyx is just the very funnel top portion of all of the medullary region runs, okay, as that urine is running into, is collecting, and that is going to drain into the renal pelvis, the most superior portion of your ureters, and then drain down, of course, to your bladder, and eventually to your urethra, and then hopefully out of your body when you want it to leave your body. Okay, of course, we'll talk about that in later portions of this video. So I had a student many years ago, when I talked about it in class, they were like, oh, that's a cow licking the pelvis. Okay, so I was like, oh, it's kind of weird, but it helped that class to remember it. So if it kind of helps you remember that the calyx directly are a portion of your renal pelvis touching, that is important. But all your renal calyx are, I know it's a funny sounding name, is just a little funnel. It's literally a portion of the renal pelvis that allows that urine to flow into that basin and eventually to flow down the ureters. So know the parts, okay? And next you're, of course, going to see those parts that you can physically, like these names I've talked about, are parts that if you were to take a cow or a pig's kidneys, you could actually literally physically see this without looking at a microscope. So look at this next section now. Within this demonstration, I'm going to show you the parts of the urinary system, and then we're going to talk about each one of them individually. So as you can see with our skeleton here, that the kidneys, and you have two of them, are going to be located about the last thorax vertebrae and the beginning lumbar vertebrae. So we have two of those, two kidneys. And then you'll notice coming off of the kidneys are these straw-like tubes called ureters. Now the ureters connect directly to the urinary bladder, and then the urinary bladder, the last portion of it, the tail, is called the urethra. So definitely know the four main organs of the urinary system. Now let's look at each one of those individually. Now, one thing that's important to understand about the kidneys is where the urine is going to be made. And as that urine is made, it's going to drain through the plumbing system. Now, the plumbing system is these two ureters that we'll look at, the bladder, and then from the bladder, when it's time to release the urine that is stored in it, will drain down the urethra to leave the body. And in a woman, it is going to be a separate tube. And in a man, it's going to be the same tube as of the reproductive system. In this portion, I want to look at a kidney attached to the ureters that has been cut open, so we can look at the areas of the kidney that you could actually see with your own eyes if you were to take a cow or pig's kidney and cut it open. So let's look at some areas here. Within our kidneys, there are several different names that we need to be aware of. Now, as you see through these names, do not let these names confuse you. Okay. Now, the kidneys themselves are encased on the outside with a capsule of connective fibrous tissue. And underneath that is going to be a layer of adipose tissue, which is going to help to insulate the kidneys. Now, as you go from the superficial layer to the deeper layer, there are going to be two names that you see there. There is the renal cortex and the renal medulla. Now, the renal cortex I have made in the red. It is the more outside superficial portion of your kidneys. And the renal medulla are the pink areas, and I've put just a few here for you, but you have a lot more within a kidney, and that is going to be closer to the middle of your kidney. So cortex and medullary region is going to be very important here in a little bit when we look at the microscopic level of the kidneys. Now, as urine is going to be made, and remember, urine is only made within the kidneys, not within the tubes that come off of the kidneys. And like I said, we'll look at that here after a little bit. Now, as urine is made within the cortex and medulla region, that urine then is going to connect up to a area called the calyx. Now, the calyx are a little funnel, and again, calyx, depends on singular versus plural. The calyx are a little funnel that is going to funnel urine into the renal pelvis. Now, the renal pelvis is a portion, the superior portion of the tube, the straw that comes off of your kidney called, if you follow it down, the ureter. Okay, so you have two ureters because you have two kidneys. So that straw, that tube that connects directly up to your kidney, the superior portion are the renal pelvis, and the little funnels at the top of the renal pelvis that is a portion of your ureter is the calyx. So urine is made in the cortex and medullary region, which you're going to see later on in the video, and then as the urine is draining into the pelvis through the calyx, it will go into this basin area and then funnel down your ureter, which we'll talk about what the ureters do later on in the video. Now, one thing I want to also point out, there's an area here called the hilum, and the hilum is just where the veins, renal, artery, and vein go into the kidneys. Okay, so it's that little region there where you will find the renal artery and the renal vein. And later on, you're going to see a direct connection between an artery, a capillary, and a vein as it spreads out over this region. Now, within that video, when I talked about the renal cortex and the renal medullary region, one thing I want to point out is that unit of the nephrons. Okay, now remember, nephrons you're going to see in the next little portion here to demonstrate, to help you visualize it. These are the little microscopic, can't see them without using a microscope, basic units that actually creates and makes the urine. Okay, so nephrons, we have millions of these nephrons. Now, what are nephrons? They begin as like this hollow kind of a cup-shaped bulb on them called a glomerus, okay, or glomeruli, and it's within a capsule. Sometimes you also hear it called the Bowman's capsule. And the structure actually literally gets its name from a cluster of capillaries that surrounds it, called the glomerus, and it's a Latin word, some Latin for you, that literally means ball of yarn. And if you look at it, when you see it, it actually kind of looks like a ball of yarn. Now, this combined unit of the glomerus, or glomeruli, within that capsule, that Bowman's capsule, is where that the filtration happens. Okay, so this is the filtration device. Now, again, remember, in your books, they're going to have, like, they just show one, but remember, all around that inside of that kidney in that cortex and medullary region, you're going to have millions of these guys. And, you know, thinking back of kind of remembering the respiratory system of those alveoli, remember we had millions of those guys, okay? And when one of those grapes started dying or were squished, then we can no longer exchange air. Very important with these guys. These are the guys that filter your blood. So you think about, 20 to 30% of your blood at any given moment is going to these nephrons and filtering things out of your blood that the body does not need anymore, that once they're damaged, they are gone, then that's when the kidney functioning starts going down. So think about renal failures it's the nephrons that are damaged or are gone or dead, no longer functioning. That is what it's going to be, those percentages. So think about if they're all healthy, there's 100%. If, 20% of your nephrons are no longer working, then you're only having 80% kidney functioning. Then of course as you go down that slope, when you get to 30% or less, depending upon the urologist, that's when you're going to have to be putting on a outside filtration system for your blood, which is dialysis. And I'll talk about dialysis here later on in the video. So when you think about the nephrons, these millions of them, I'll demonstrate one within the demonstration here in a minute with that glomerulus capsule. That, remember, capillary's job and anything that I've talked about is exchanging between the blood and the cells of the body. Okay, so the blood system, of course, then is going to have a capillary, and every single cell is going to have a capillary near it. Okay, and that's where that exchanging between blood and cell is going to occur, that homeostasis back and forth. Now, there are many tubes, okay, within this. And remember, the blood is coming to the kidneys, coming to the individual glomerulus, that Bowman's capsule, through an artery, okay? And of course, you have the artery, which is renal, okay? On one side, capillaries connect there. And then you're going to have capillaries that only start at the glomerulus, but are going to surround a series of tubules, okay, or tubes, that are going to, again, filter the blood. And then what it wants to keep, it's going to put back into the capillaries that surround these tubes and send it back around the body again. Okay, now these capillaries, after they leave the glomerulus, you're going to see are going to surround the tubes that are called the peritubular capillaries, hence around the tubes. Okay, and now one thing I want to point out, and I'll mention it, I know here in a minute again, but if the liquids stay in the tube, they are leaving the body. Okay, so if I put something in the tube and it stays in the tube the whole journey in the nephron tubes, eventually that tube connects up to our straws, another tube that connects up to our bladder, and then the tube that comes off your bladder is going to be your urethra. Okay, that's important to understand. But if it's in a capillary, okay, so it leaves the tube and goes back into a capillary, then it's going to stay in the body and go around again as many times as it needs until it's put in the tube, and then it stays in the tube and then eventually leaves the body. So of course we can't, have all the blood. We can't have 4 to 6 liters in our kidneys at all times because we need blood flowing through our body, okay? Because remember, cells don't have oxygen near them. Then getting oxygen, they're going to die. So again, that filtration is important, but not all the blood is in the kidneys at any given time. It's just getting in, 20 to 30% being filtered, going back out. I'll be honest with you, most of the blood that goes to the kidney stays in the capillary system and it continues around the body. It's only 1% of our blood at any given moment that gets into the tubes and stays in the tubes, but even then, some of that 1% can still leave and go back. And of course, we'll talk about, I'm getting ahead of myself, of those processes of reabsorption and secretion. Okay, that just kind of means keeping it in the tube, giving it to the blood, or the blood giving things to the tube that it no longer wants before it gets to that en route itself. So kind of like getting on a bus and then eventually, I decide I want to get off the bus at this stop, don't want to go to back to the station. Okay, so there's always that way through the use of hormones that things can stay in the body or leave the body at any given time. So we have tubules. Okay, so the names of those tubules are the proximal, the beginning, that comes off of the glomerulus. Then you're going to see the nephron of the loop of Henle, okay, the nephron loop that goes down. And then lastly, we have the distal tube. Okay, now all these are, except for the loop of Henle, are convoluted. So we have a proximal convoluted and a distal convoluted, like big fancy word. It literally means kind of twisted up. Okay, so think of like a crazy roller coaster ride. Okay, so we go from proximal convoluted tubule that connects to the glomeruli, the Bowman's capsule. Then we go down the hill through the loop of Henle. Then we go to the distal convoluted tubule. Now, all of these nephrons, that distal end connects up to a lesser amounts of these collecting ducts that a lot of these nephrons connect up to. Okay, you may have hundreds or thousands that connect up these collecting tubes, and these collecting tubes then are directly there with that cowlick. Okay, so collecting tube or duct connects up to your cowlick, and if you remember what the cowlick was, it is a little funnel that is going to drain the urine into the basin, okay, the renal pelvis, and all of those two names, cowlick and pelvis, are renal, so they're kidney, but even more precisely, they are the superior portion of your ureters. and then of course the urine is going to drain down and eventually go to bladder and urethra. So watch next of the names that is talked about. Within that also, I'm going to go ahead and demonstrate, in that demonstration, going to talk about the processes of filtration, reabsorption, and secretion. Okay, so definitely understand and listen to that portion, because I'm not going to talk about it outside of the demonstration on this video of what filtration is and where it happens in the nephrons. You need to know that. Where reabsorption happens in the nephrons and where secretion happens within the nephrons. Okay, just remember, of all of that, it's either staying in the tube. If it stays in the tube, it leaves the body. Okay, so if I have a let's say red blood cell that got into the tubes, and it's going to leave the body in my urine. So hence I would see blood in my urine. Not a good thing. Okay, it can be okay. Okay, obviously as a woman with her menses, but we definitely do not want blood in our urine for the most part. Okay, but we think about red blood cells, then okay, not the tube, goes back to the capillaries. If it's in a capillary, it's going to stay within the body. Okay, but can the capillaries give to the tubes? Yes. Okay, that's what you're going to see next within the demonstration. Now that we've looked at the view of the kidneys that you can see, let's look at the microscopic level of the nephrons. Now within the cortex region, the more closer to the surface, superficial, to the deeper regions of the medullary region, is where you're going to find this complex of tubes and capillaries called the nephron. Now the nephron consists of the following things: a renal artery bringing blood into the capillary bed. After the peritubral capillaries that connect up to the arteries will then bring blood back to the renal vein to bring it back to the heart. So blood supply is the first thing we have. Now, those peritubular capillaries are going to surround a tubal system called the renal tubes. Now, the renal tubes have three different sections to them: a proximal portion, a nephron loop, and a distal end. Now, at the distal end, the connection is going to connect up directly to a collecting duct. So let's look how urine is made within the nephrons of your kidneys. Now, as blood is brought into the kidneys, and about 20 to 30% of blood is brought into these nephrons. Now, this nephron system is a system of capillaries and tubes that is going to help to filter the blood. Now, as blood is brought into the arteries, it is going to be within this region of your kidneys. So remember, arteries come in, then they're going to branch to the outer portions, and that is where you're going to find these nephrons. And the capillaries then are going to surround, they're the red, all of the tan that you see there would be the tubes to connect back up to the vein. So as blood comes into these nephrons, it's going to come into the capillaries, and there's a beginning portion called the glomerulus. Now the glomerulus literally means ball of yarn, and as you can see, it is the beginning portion. So as blood comes into the glomerulus, then 1% of that blood then is going to continue on through a tube system called the renal tubules. Only 1%. The rest of it is going to continue down the capillary bed that surrounds those tubes to go to the vein and to go back to the heart and go around the body again. But 1% of that liquid that is filtered out at the glomerulus is going to go through that tube system. So it goes through the proximal portion, down the loop of Henle, also known as the nephron loop, to the distal end, and eventually connects up to a collecting duct. Now the collecting duct has many, and I actually just went ahead and connected another one so you could see it. So there are collecting ducts that connect up a lot of these individual nephrons. Okay, so you have a lot more individually nephron system than you will these collecting ducts. But we have millions of these tubes and capillary, and that is how the urine is made. Now, as that 1% of filtrate is going through the tubes, the body has to decide whether it wants to keep it in the tube. And if it keeps in the tube and gets all the way to the collecting duct, the end place it's going to end up at is a ureter. And the ureter then is, of course, going to drain the urine out of the body. So it stays in the tube. Anything that stays in the tube is going to leave the body as filtrate. So blood has came in through an artery, has gotten to the glomeruli. 1% of that has gotten into the tube system, and it goes proximal to nephron loop to distal. Now, along that passageway, the body can do two things. It can either reabsorb whatever's in the tube back into the peritubular capillaries, or it can allow that liquid to continue on through the tube to exit to go to the collecting duct and out of the body. Now, also, besides reabsorption that it can do this thing called secretion, and that's just putting things that are already in the capillaries, that 99% of filtrate that is in the capillaries heading to the renal vein, things that it wants to put back in from the blood supply back to the tubes. So it's that back and forth exchanging between tubes to capillaries. So things that are in our blood can stay in the capillaries to go around the body again, or they can go into the tubes to leave our body as needed. Now, baby manatee is going to help us on the journey. We're going to visualize him as being an electrolyte in the body. So as an electrolyte comes in to the kidney through the renal artery, it's going to go next from artery to the glomerulus. And remember, glomerulus is going to be that group of capillaries. Now, in this case, instead of going around peritubules to go back to the renal vein, he is going to go into the tube system. So, renal artery to glomerulus, and then that 1% of the filtrate of the blood is going to be filtered into the renal tubules. So now he's going to go through the proximal to the loop of Henle, to the distal, all the way to the collecting duct. Now, somewhere along that passageway, and we'll go backwards from collecting duct to the distal, to the loop of Henle, which is the nephron loop, to the proximal, somewhere along that way, if he decides he wants to get out of the tube, he can get out of the tube and go into the peritubular capillaries and then go to the renal vein to go back inside the body. But let's say as he's taking that journey and as he's getting to the collecting tube, you could also then, because of those capillaries, go back into the blood supply to go back to the heart. So it's that back and forth. Now filtration that allows it to go into the tube only happens at the glomerulus, and that is directly controlled by our blood pressure. So blood pressure is pushing that filtration, is pushing these elements to the capillaries. And at the capillary beds is where things are exchanging. Now, 1% of that filtrate of your blood then will continue on through the tube system, and that gives the body enough time to figure out within the kidneys whether it wants to keep the stuff that's in the blood or to get rid of it and keep it in the tubes to get it out of the body. So filtration only happens at the glomerulus, the Bowman's capsule as it's also called. So the glomerulus is just a group of capillaries inside of a capsule called the Bowman's capsule. Now, if it's not filtered at that point, it continues, then is pushed into the tubes. In the tubes is where you can find the processes of reabsorption and secretion. So using baby manatee, reabsorption is I'm in the tube and I want to go into the red capillaries, which are called peritubular, because I want to stay within the blood to go back to the vein, to go back to the heart and around the body again. So that is reabsorption. It only happens within the renal tubules, mostly the proximal and the loop. Now at the distal, closer to the end, the distal end of that renal tube or the collecting duct are two areas that are controlled by hormones, aldosterone and ADH, antidiuretic, that allows things that are in the capillaries. So let's say he didn't get into the tube, he went into the capillaries, and now he's in the capillary and he's heading down to get to the renal vein. He's like, wait a second, I think I want to stay within the body. So secretion secretes things that are in the capillaries back into the renal tubes to allow it then to go then to the collecting duct, and from the collecting duct we go to the ureters. Now one thing I want to point out about the collecting duct, and I'll bring baby Manatee up to our bigger model, is if it's going to the ureters, remember what's before the ureters. We have the renal pelvis and the calyx. So remember these nephrons, and we have millions of this tube system with capillaries surrounding it, is going to be in the cortex and medullary region. So that collecting duct is directly connected to the calyx, that little funnel, and then that urine, once it reaches the calyx, it is urine at that point. It is leaving the body, so that's very important. So the collecting tube duct is the last stop before the train leaves the station. So if the urine is in the calyx, that funnel, and in the renal pelvis, it is leaving the body through the ureters. That nephron system is how that our body makes and filters the blood. That is how our body makes urine, by filtering the blood at the nephrons of our kidneys. And when the nephrons units are gone, then our body can no longer filter the blood. Now, just a reminder that the nephrons are the units inside of your kidneys that are making urine. They are filtering your blood. Now, the glomerulus is the group of capillaries that is directly connected to your renal artery. Within that region is where filtration happens. Now, filtration that only happens in the glomerulus, inside the Bowman's capsule, 99% of the stuff is going to continue on through the peritubular capillaries that wraps around your renal tubules, and those capillaries then directly connect to the vein and is going to send that 99% of filtrate back around the body. The tubes is where you're going to find reabsorption and secretion. And the two things that will be in play will be the tubes and the peritubular capillaries. So once the 1% of filtrate gets into the renal tubules, that filtrate then can either be reabsorbed into the body, so that's going from tube to capillaries, and then it goes back to the vein, or somewhere along the way, and it's usually towards the distal and the collecting duct, secretion can occur. And secretion is going to be when things leave the secreted out of the capillaries into the tubes to leave the body. The tubes directly connect up to the collecting duct that connects up eventually to the ureters to bring urine out of the body. So reabsorption is from tube to capillaries. Secretion is from capillaries to tube. And remember, if it stays in the tube, it leaves the body. If it's in the capillaries and stays in the capillaries, it's going to the vein to go around the body again. Now, the last part I want to talk about of the urinary system are going to be the plumbing. Okay, so again, the kidneys, the ureters are going to be inside of your kidneys, but the ureters themselves are just going to be these straws, these tubes that are going to allow urine that is got into the calyx, that's got into the renal pelvis. Now it's draining down the tube to connect that urine directly to your bladder. But this is an area that is very innervated with a lot of nerve endings. Okay, of course it has a mucosis lining of membranes inside of it. It has a muscle aspect also too, where it's constantly doing peristalsis, pushing action. But if you were to get a kidney stone that moved into the ureters, you're going to feel it. Okay, and that's why it's very painful when you get kidney stones, because you're feeling it literally go down the straw. Okay, a tiny little straw. Now at the end of the ureters is directly connected up to your bladder. Okay, so know that the purpose of the ureters is to drain the urine from the renal pelvis, the top, the most superior portion of that ureter, all the way down to the urinary bladder. And peristalsis helps with that. Now, the bladder itself, where it connects at an area called the trigon. Okay, a trigon is just a triangular part of the bladder itself. And one thing I do want to point out about the ureters is the ureters are protected by one-way valves. Okay, so things should be flowing down the ureters, and they have like a hook type of shape that connect the openings of the ureters are at the top portion of the trigon. Now, I know personally because one of my daughters had problems with and it might have been a hereditary thing, even though I didn't have any problems. Sometimes, things you'll hear about in future videos when I talk about the genetic part. Things can be sometimes passed down through generations. On the left side, her left ureter, every time she was peeing, instead of the urine, with those valve systems going from the kidneys to her bladder, that pressure that was inside, every time that the bladder, of course, gets smaller, was pushing urine back up into her kidneys. Now, definitely remember, when you think about waste, we want to get waste out of our body, and that's what urine is. Urine is waste. Okay, most of it is that nitrous waste that we definitely need to get rid of. And of course, the urea is what most of our urine is consisted of. So we want to get it out of our body. So they ended up having to do ureter reimplantation, where they did a little cut, okay, at the pelvis region. I think, and like where they would do a C-section at, took that little straw out, okay, the ureter out, because you can there, that opening at the trigon, and did a little bit more of a hook of it, kind of, instead of it being just a straight tube, and reimplanted it. And hallelujah, it's been, let's see now, going on 5 years. She's no longer had any more kidney infections since that surgery. So definitely important to understand that you cannot physically remove the ureter at the top, because that's the renal pelvis. Okay, you need that. If you were to take it out, it would be bad. But the straws at the end, you can do some modification as needed. But for the most part, mostly the ureters are really good about not allowing through those valve systems urine to go back up into your kidneys. Now, definitely when you think about the urinary bladder, one thing to point out is something I would have talked about in many videos ago. When we talked about tissues, the tissue inside of our bladder is this transitional epithelial tissue, okay, which is very special because it has the ability to stretch as needed. Okay, so we think of epithelial tissue itself, we think of, of course, we think of that squamous, shape, or that cube, or that column shape. But in this one, that transitional shape is the one that can expand as needed and then go back to more of a flattened state as our bladder is filled. Now, we also, within the bladder, has a muscular aspect to it also, some muscle tissue that, of course, when we think about that peristalsis action, okay, when we pee, it's going to cause not only the transitional epithelial tissue can shrink down, but also there's a muscle aspect that can, of course, push the urine out of our body. Now, the urinary bladder itself, it's located, again, posterior to the front of our pelvis. Area is called the pubis symphysis region. And this urinary bladder, again, is just that temporary storage unit itself. Now, the trigon area, again, is very important because that's associated with our bladder. We do have, very similar to our stomach, of course, the muscle area of a little bit of lining that's very similar to our stomach, because think about, our stomach can expand also too as it is needed, and of course shrinking back down. And the urethra is literally like a little tail that comes off of our bladder, and it is going to, of course, be the exit, A for way, that is going to allow the bladder to empty through the use of sphincters. There's an internal and an external sphincter. Of course, one we can control because it's voluntary, one we cannot control, but also those sphincters do have to be controlled and trained as we're aging. Okay, so you think about a baby cannot control that one sphincter, but as they are doing through potty training, they're actually training that muscle to contract and relax when it is requested to do so. Okay, but there are two sphincters that you'll see next parts within this portion of the video that you will see the ureters, the bladder, and the urethra. Now, from the kidneys, once the urine is made in the nephrons, so as blood has come in through the hilum and is gotten through those nephrons, and it has become urine, it drains into the calyx, to the renal pelvis, down the ureters. Now, the ureters are directly connected to the urinary bladder. Now, one thing important about the ureters, and you have one attached directly, that the topmost superior portion of your ureters is your renal pelvis. So if you were to rip out the renal pelvis of your kidneys, you would literally compromise the kidneys. But at this end, the ureters are connected to an area within the bladder called your trigone. And the trigone is just on the posterior portion of the bladder. It's just two holes that allow the straws, okay, that are kind of in a hook shape on the back of the bladder to allow urine to go in. Now, the ureters are very innervated with nerves, so hence if you have a kidney stone as it's coming down and it's rubbing or gets stuck in the ureters, you're going to have intense, severe pain. Now, as the urine is drained into the urinary bladder, the bladder then, of course, is going to expand as needed, okay, anywhere from 200 to 300 mLs. And then the bladder, as it's expanding, it is going to then allow the urine to continue on to a group of sphincters. So the trigone is a name that's associated with the urinary bladder. The bladder, again, is going to be a storage area to hold the urine that has came down through the ureters. So the bladder itself, as it expands, slowly allows liquid to go into one of two sphincters, an internal and an external sphincter. Now, that, as you notice, it almost looks like a little tail that's coming off of our bladder because it is directly connected to our bladder. And that last organ is called urethra. So think of A for away. Now, those sphincters are very important, so there's a little bit of urine within this area, okay, of your bladder. And of course, the external one is the one that we have to train as we age, and it's a neurological thing that allows that sphincter to open and, of course, the urine to come out of the urethra. Now, once you're allowing urine to come out of the urethra from our bladder, we are doing a process called micturitioning, a fancy medical term for urination. So as urine has been made in your kidneys and has come down your ureters into your bladder, then it comes to sphincters. One you can control, the external, coming down the urethra. And once that opens, then we're doing the process of micturitioning. So next time you urinate, use that fancy word of micturitioning. So that means urination. So think about if we are not able to control that external sphincter, then we're going to have urinary problems. And again, remember, I want to mention this within the video. Urinary referring to the bladder. Renal refers to the kidneys. Now, urine itself, I'm going to talk a little bit of consistency here, like what should be within your urine. Your urine, of course, has a yellowish look to it, and we know the more yellow it is, the less water we have within our body. It should be about 95% water of our urine, and 5% of it should be the rest of those wastes, okay? Now, the pH ranges anywhere from 4.5 to 8. Some books, I'll put it kind of an average of 6, okay? But again, books will vary a little bit, so I know that's kind of a broad span. But we kind of give you the normal range of where it should be. Of course, depends on what you're eating. Now, the amount of anything that's dissolved within your urine is called the specific gravity, okay? Now, that specific gravity of pure water is the standard, and it's 1.000. Okay, that's important. Now, because the dissolved matter it contains, urine has a very specific gravity that would normally vary from 1.002, which is very diluted urine, to about 1.040. Okay, that's very concentrated urine. So when the urine, when the kidneys are diseased, they lose the ability to concentrate the urine, and that specific gravity then is no longer varies as it does when the kidneys are functioning normally. Okay, so you always remember the homeostasis, you're going to have balance. It's like your blood pressure is never the same at any given moment throughout the day. The specific value of your kidneys are going to change, but obviously we have to look at those numbers when we're looking at conditions that directly affect the kidneys and showing that they are dying. The nephrons are no longer working. Now, things normally that should be in your urine, okay? So, of course, we talk about water, but other things that, 5%-ish is nitrogenous waste. Okay, so think of nitrogen. Okay, this includes, of course, urea is the biggest one. Okay, that's when we have a metabolism of the proteins through catabolism. We have the uric acid. Okay, that's a breakdown of the foods and the nucleotide acids. Creatinine is a breakdown of muscle creatine. Okay, so we're going to have that normally within there. Again, I'm not going to talk about the normal amounts that you need to have, but these are things we should find in our urine. You will have electrolytes, so I guess obviously sodium, potassium, chloride, sulfates, phosphates, things like that. And then, of course, pigments of all the foods and the dyes and the breakdowns of, think of bilirubin, the yellow, and all that. Okay, so there's going to be some, of course, drugs, things like that, hence why they do a urinalysis for background checks. Now, things that are abnormal, we normally should not be finding in our urine in a normal basis, okay? And that's why they do a urinalysis, which is an examination of the urine. It's a very important part of figuring out literally like what is happening within my body. Because if you think about taking the blood will show me, but definitely doing a urinalysis is a very, I don't want to say quicker way, but it's a very quick way to kind of determine what's happening within the body. Now, glucose is usually an important indicator, if we have it within our urine, of showing that we have diabetes mellitus. Okay, with the cells do not accurately metabolize that blood glucose. Excess glucose then cannot be reabsorbed from the tubes and is excreted in the urine. Okay, so glucose needs to leave the tube and go back into the capillaries to go around our body. But we have so much of it, it can't get into the capillaries. Remember what I said earlier? If it stays in the tube, it's leaving the body. Okay, so that's why it really is a big indicator of conditions such as diabetes, okay, mellitus itself. And that's when we get into, of course, glucose in our urine, okay, urea. Now, the next one, if we have damage to our glomerulus, we're going to find that protein in our urine, that albumin. Albumin is, of course, one of those proteins that we would have talked about in the plasma, and this is going to show that there is no reabsorption that's happening. It appears in the urine, so again, it's not going from tube to capillary, it's literally staying in the tube to leave our body. And that shows damage to your glomerulus. Now, if we have blood in the urine, I mentioned that earlier, normally should not be there because red blood cells are really large, but that hematuria means that it's an indication that we have some type of urinary system disease, okay? So it could be a bladder thing, especially if you have a urinary tract infection itself, or it could point even further back upstream. Of course, that would be the kidneys themselves. Now, ketones is another one, again, some abnormal things in our urine. These are produced when fats are incompletely, again, broken apart. Ketones in the urine are also seen in such conditions such as diabetes mellitus, or also starvation, because it's showing us that the body is consuming itself literally, okay, so breaking down the muscles within our body. Now, white blood cells, of course, we think about, of course, urinary tract infections. So again, we'll be having type of infection. That's where we're going to find that within our urine. And then a thing called cast, which are solid materials within the tubules. Okay, so we think of the kidneys. They consist of cells or proteins, and when they're present in large numbers, they will indicate damaging to our nephrons. Okay, so a couple of things there you can kind of see, either, the nephron as a whole, the tubes are breaking down, they're dying, so you feel a lot of cast. And that's when they look for, like, of course, the Bunn numbers. Of course, we think about the nitrogen levels is what they're looking for when we do the measuring of the urinalysis. Now, the last portion I'm going to talk about is, of course, urinary system disorder as a whole. They kind of classify them by either obstruction or structural. Okay, so we think of something obstructing would be something like a kidney stone, okay, or called a renal calculi is a kidney stone, okay. So again, this is usually made of like a calcium salt, or it could be a uric acid salt. That is, of course, think within our kidneys being made. If they're too big, we can't pass them, then they could get stuck in the ureters, or even worse, they could get stuck in the urethra along the way. Now, we think about the structural abnormalness would come from a lot of times genetics, okay? So again, all parts of this can have that congenital present at birth abnormals. Kidney ones are more common. About actually 10% of most babies can have some type of, kidney, again, that structuralness, that would, of course, be the anatomy part, which eventually, of course, affects the physical functioning part of the physiology. Now, the other things would fall under, as far as disorders, would be inflammatories. Okay, so think of the itises, such as a UTI, which is urinary tract infection. You could get, of course, infections of the tubes, the nephrons. You could get infections then of the ureters. When we think about inflammation of the glomerulus. So again, kind of look at the beginning of the names, and if, of course, the ITIS stands for inflammation, that's literally telling you what part is inflamed. And again, we think about any type of inflammation. Usually it's characterized by the mucous membrane internally. It could be the gland of some of these parts. That could be either through poor hygiene or a lot of sexually transmitted diseases. That could be, again, that bacteria crawling and going places that it does not, or even a virus that has infected the cells within those organ parts. Now, you can get tumors within this area, of course, cancers, neoplasms, like I've talked about in prior chapters, that can affect any organ within the, again, kidneys or the ureters or the, bladder. But again, it depends what type of tissue that we were referring to, again, within this organ system. Now, the biggest one when you think about the kidney renal is going to be renal failure. So when you hear that name, you think, okay, the kidney itself is no longer working the way that it should. Now, you can have acute, okay, so you've done something to your body, had damage, maybe drank too much, glucose on a regular basis, and it's overworking the kidneys itself. It can't excrete as quickly as it should. Now, chronic renal failure is usually that gradual loss. So we've seen that started out acute at one point, and that's why there's a lot that's tied to, of course, glucose and diabetes, of course, causing renal failure, or having too many drugs in my system is going to cause those nephrons to die. Now, characteristics you kind of look for of chronic renal failure is, of course, obviously losing a lot of fluid, so dehydration. The opposite of that is retaining too much fluid because you have edema. And of course, I would have talked about that exchanging of, again, reabsorption versus secretion, and how that plays a role into it at the kidneys itself, not even getting it into the ureters to get it out of our body, or vice versa. Of course, that's, controlling the electrolyte balance within our body. If you have high blood pressure, hypertension, that could cause, again, that sodium and potassium, even that water, of course, balance with that, to retain too much. You can see conditions such as anemia, of course, think of red blood cells, and urea is, of course, too much nitrogen, okay, too much urea within our body. Now, if you are having renal failure, and again, I'm not going to get into, because this is not that type of, class that I teach. It's basic anatomy and physiology. But when you get into renal failure, dialysis, that name literally means the separation of dissolved molecules based on their ability to pass through that semi-permeable membrane. Okay, so again, going from gradient from one side, high number, to low number. Okay, passing through filtration. Remember, filtration is a passive process. Molecules that can pass through the membrane move from an area of the high concentration to an area of a low concentration. Now, someone that has a renal dysfunction, that means the urea and all that waste products accumulate in the blood, are most commonly reduced by passage of the patient's blood through a dialysis machine called hemodialysis. Okay, and the principle of this is having the molecules leave the area of great concentration to remove the waste from the blood. So literally that machine is filtering, doing what the kidney, so it's an external kidney literally, so the blood goes in and forces out the things out of the blood that the body no longer needs. Now you can do one internally, okay, so again you think of hemo relates to the blood, where they would have a peritoneal dialysis. The principle behind this one is introduced into the peritoneal cavity. The peritoneum acts in as like a membrane system itself for dialysis, and again you would be hooked up to an IV and it would flow into this. That would be an area that would allow some exchanging to occur, and then you would have the waste that would come out of the things the body no longer needs. But most the hemodialysis is performed, of course, in a freestanding clinic. And so when you think of dialysis, a lot of people truly think of that type of dialysis. It's 3 to 4 hours, typical 3 times a week. Okay, but once you get on it, that's your kidneys. Your blood will get too thick, and the pH will go back to 0, and unfortunately, you will have organ failure. Now that's the renal side, so that's the kidney side. So remember I mentioned earlier, renal refers to kidney. The other one is urinary. Okay, so urinary, think of incontinence. Okay, so this refers to the involuntary loss of urine. So again, the kidneys are working, they're sending. So we think of suppression. Renal suppression refers to, of course, the kidneys are not working. We think of urinary, okay, so think of urinary problems. Urinary suppression, okay, would mean that the kidneys are doing their job, but the bladder is not getting rid of the waste, okay. So a lot of neurological disorders can also cause that trauma to certain, of course, other diseases, anywhere where you have a disconnect between the brain neurons to the urinary bladder neurons. So we think about, of course, bedwetting in kids. We definitely think about, of course, that's a urinary incontinence problem, but we actually, through the use of neurons, that is how we actually can control whether we are releasing the urine through that sphincter system that is opening. So hopefully within this video you've learned a lot about what is happening within your kidneys and where the urine is being made. Definitely important thing to note. It is almost impossible to get a urine sample because obviously they live in water, we do not. Usually you have to have them in a surface. If you had to get a urinalysis of a manatee, it's a lot more difficult than us. Hopefully within this video I've helped you to learn more about the urinary system and appreciate the next time that you do the process of micturitioning, which I would have talked about earlier within the video. Talk about it. So next time you're going to the restroom and have to pee, say I need to go micturition before it ends up on the floor. Look forward to seeing you next time.